Okay, so we continue work on Daniel. So Daniel, come over here, and we're gonna check his shoulder, how he feel today. You done any homework, Daniel?
Yeah, I did some exercises.
Great. Let me see. So remember, we just did this a week ago, and see how this work. Let's see your shoulders.
Let's start.
Yeah, this is really good.
And not the best one.
I mean, you see, he's back to this to this kind of same distance. What we're going to do, but the neck is not tilted anymore. So it's a good stuff. What we're going to do, we're going to work on his neck. So go ahead and I don't know if you guys can see a lot of working on the neck. So lay down, face up. Perfect. We can do zoom in, zoom out. Let's take your glasses off. So okay. Someone took neck. What we're doing with neck first, we want to check. I'm also pay attention on the shoulder distance between that acromial process and all the way down to the table. Sometimes you can see the shoulder is really high. The distance is like 3-4 inches. Here, it's probably like, 3 inches. It's still a little bit high, which is mean the pecs, it's tight, it's dominating, and it's pulling the shoulders forward. The idea is to see his head, how the head is on the table. And remember, we're testing the neck, and we're going to do this right now. So we ask him to rotate to the right. Rotate to the right. I see a little bit restrictions, and let me help him out. So this is the passively. Can I go further? No, it's kind of jammed. We'll go ahead to the left. Which way is it more difficult for you to turn?
To the right.
To the right, correct. So what I'm seeing, he's perfectly rotate to the left, and he's reached that level, that angle without any problems. You have to be 80 degrees rotation, so no problem. And I can help him. Any pain?
No.
No pain, but some limitation. And this is mobility problem on that right side. What I want to test right now is that the lower portion of the neck is a problem, or is the upper neck, so like a OA joints. And what I'm doing here, so I'm already check, we turn, and see if I can tilt it to 20 degrees. Is any pain?
No, just a little discomfort.
Little discomfort, and it's
On the
also
lower
limited.
part.
Yep, okay, let's turn this way, and I'm tilted this way. Which way is better?
I mean, I think I feel discomfort on both.
Okay, so what we find out, I just take this off because it's getting hot in here. What we find out, he's barely have some issue to turn to the right, and when he tucked the chin, he got little discomfort. So he might have a OA joint, and that right side is kind of jammed. What we want to do now, we want to check if we have a nice rotation. When we check rotation, we get this head in 45 degrees. We're holding it, and we try to rotate to the 45 degrees. See if we reach 45 degrees. Is any pain?
Yeah.
He feel pain. So that's mean, and to the left?
No.
So in the right side, we have some pain. That's mean his head, the neck is not functioning. We have to correct that. That's might also restrict that shoulder, because neck and shoulder, everything connected. Here we go. So we get a little bit, drop the oil, just make that hands not that dry. I don't use too much oil at all. And my first treatment, I'm turn the head non-painful side. And what I'm doing here, I found that aluminum groove, and not in the middle of the occipital area. I found that aluminum groove a little bit on the side, and what I'm gently do, I'm start moving Gently see if any pain and restrictions. I always tell the clients, if you do feel pain, you let me know. So I rotate the head to the left, and what I'm doing, I'm moving all the way down from C7 to C7, so C1 to C7, all the way down. You feel okay?
Yeah, I'm feeling good. I mean,
No pain right there?
it's kind of pain is too significant word for that, but discomfort, yeah.
Discomfort. Okay, so I'll go a little bit slowly. Always make sure the client is not experience any pain, because if he experience pain, his brain is gonna lock it in. He's not gonna be release that. We don't want people feel pain. Very gently. Tuck. Okay. Now I'm holding right here and I start stripping down. So my finger, that lamina, and I feel stripping down. Stripping that down. You feel that right there? Right in here? So what I feel when I stripping down that lamina, I feel that one of the vertebra, it's kind of rotate and pull my finger away from that path. So it's right in here. And sometimes you'll be surprised because you're going to be work on that non-painful side and it's going to be corrected. The pain is going to be gone. So the problem is not at the same side. You need to release the other side to get that balanced. Because if your head is tilted to the side, which side is going to be tighter? This one is tighter, this one is weaker. The pain is going to be on that stretch side, on that weaker side. The tense side is not going to be problem, it's just a limited, right? It's all different cases. So that's why you need to do those assessment. You need to ask him to move around. Remember, rotation, flexion, extension. We don't do side bending. I see a lot of people try to do side bending. No need to do that. So I work gently, start stripping again. Working on that first rib. This is the first rib and clavicle. People sometimes is like skip that part. It's really important to decompress that first rib and ask clients, if you feel any tingling, pain, you let me know, okay? Because sometimes it's painful. Is that right there?
No,
You feel it?
That feels really good.
That feels really good. So you see, I'm doing 2 fingers. I put that in the clavicle, and you can move the head around, like rotate side to side. Make that action and feel what's happened when he's rotate that neck. Is that rib is popping, and sometimes you will feel that. Touch that clavicle, move that clavicle around. I always like to move that clavicle. I grab, sometimes I put this on the sternum, and that manubrium, and I just moving around, see if anything, if everything moving. Yeah, everything is moving. I feel that. The joints, that clavicular mandibular joint is good. That acromial process is moving too. It's great. So everything is moving. Right there, right? You feel that?
Mm-hmm.
I feel that's really, really close, that clavicle to that first rib, right in here. I don't know if you see on this camera. I will probably do some zoom in and moving around towards and away. You see, I'm rotate and I'm moving away. Feels good. No pain? Great, no pain. I'm go back to that stripping again. Like I said, you can go back always when you started. Now that attachment, the SCM, sternocleidomastoid muscle, I found it right in here, and I'm just stripping that down. Stripping that down. Next one, I'm going to work on that sternocleidomastoid. And to work on the sternocleidomastoid on the right side, I always bring the head to the right. So you contract that muscle. Now you can easily to find that sternocleidomastoid. And all you want to do, you want to strip that muscle. So I grab the all the way in the bottom and then insertion and pull up all the way to that skull. And I always ask client, if you feel any like sensation go above your eye or in your head, just let me know, okay? Sometimes people even feel in the arm. Doing okay?
Mm-hmm.
Nothing, you don't feel anything?
No, that this feels good.
That feels good. And I'm not rushing myself to do that treatment. I see people doing this very slow, gently. You see, I'm kind of open a little bit more for the camera, what I'm doing, but I usually contract it more. And it's so you can grab like this. You can grab the hook, go under, you see under, and the big thumb starts to do this gliding. And what I find out, yes, it's right in here. You feel that trigger? So sometimes people just call this trigger point. That's a very sensitive spot. I'm just work a little bit around this. Give them a little bit time. And stripping more. And let it go. Next one, I do decompression. I start also with decompression if the people don't experience any pain. The client was experiencing pain, so I'm kind of a little bit gently here, try to relax. You see, he's kind of like guarding. Yeah. So you always say, hey, let it go. Take a deep breath. See how the client is breathing too, how his chest is raised up, which one is a left or right, and kind of pull. You see, I cross my fingers like that, hands like this, and I pull, and I'm open this up. And of course, here we go. And I do feel actually a lot of stuff on the left side, not on the right side. So you feel that bump?
Yeah, I start to feel more tension once you start working on the right side. I feel more tension on the left side.
Exactly. Can you believe this? The problem was when he turned to the right, it's pain, but the old, like I said, stuff on the left side. So because I'm start turning to the left and I feel a lot of stuff going on up there. Try to relax. There we go. And I do feel, so I stripping that on the lamina groove and I feel a lot of tension. Very gently, don't need to do crazy stuff with the neck. Always gently. I see people like do some dropping from the table, pull it up, all that kind of stuff. If this is young athletes like Daniel is, yeah, you might do this, but with a person with a lot of pain, especially after car accident, whiplash, need to be really careful. And of course, give them exercise, which is we guys posted a lot of exercise for the neck on our channel. So it's right in here. You feel that?
Mm-hmm.
Yeah, I feel that. That's really bumpy. So every time when you drive, like a slide your thumb on that aluminum and you feel something bulky up there will pull you out, that's where those vertebrae start twisting. So that's the stuff. Bulky right in here. Start turning head, rotate head left and right. Rotate, not the side bend. Rotate. See if I can help. Pain? Good. Every time ask if any pain. So I do some motion right now, rotation. See if any pain is present. I see people like turn to the side, open this neck, and they grab like a tuning fork. And what they doing, they start stripping this way. This is good stuff. And tuck the chin. So I see I'm tucking and stripping. Yeah, some people do this way. Some people do with the same arm. See, it's get redness. Tuck that chin. tuck and relax. Good, tuck and relax. Okay, I'm gonna do the same. See how that side is that, look at this, he's turned much better. And now, I'm start doing this, tuck the chin and work on that laminum. And I feel a lot of this side is which is restricted, very easy. Yeah, you see, and he start guarding right away. So because he brain know if he turn to the right is painful, so easy, easy, don't push too hard and very gently movements. So you're probably not gonna see this on this camera, but what I'm doing, I work on that laminum, each vertebra, all the way down from C1 to C7. Right there. And if I feel it's a lot of stuff going on, I'm also send them to the chiropractor. Why not? That nice, good adjustment on that vibration gun, it's always do the magic too. Work muscular and work that skeleton system. And if you're not a chiropractor, guys, stop doing those adjustments. I see the guys watching on those YouTube channel now, and everyone adjusted neck right now. If you're not licensed in United States, you can do this in India because no one give a shit about what's going to happen to your health. But here in United States, we do. And if you do some damage to your clients, you're going to be responsible for that. And so just do what your scope of practice is. Don't cross it. Don't adjust it. Very nice. Move around. Another one, again, decompress. My client is a little bit kind of guarding. I can feel that. And I'm working first time on his neck, so I'm never working. Does that feel tingling, numbness?
I start feel numbness on the
You
left
see,
side.
I'm working on that left side and numbness go away. So that's that C3, C4, something up there. So I work in specific on that spot. What I'm doing, I'm kind of side bending and a little bit rotated and try to push in and out. So I'm moving that vertebra and that's what I feel. It's exactly on that C3. Yeah, right there. You feel that bump? Yeah, you feel that too. If you feel those bumps, don't ignore it. Work, move around. Gently. I love side position to work on the neck. When open the neck, I can do sternocleidomastoid. I do scallions muscle, all those trapezius muscle you can work. Rotate again. Feels good? Right there. And I'm just working around. I know you guys don't see it. We probably need that glass table so we can put the camera onto the table and you can see my hands. Or just join our class in August 16 and we'll show you all those techniques in here. So I feel this left side, very bulky. Next one, I love this treatment. We teach our client to rotate, and at the same time, we release all those scallions muscle and posterior neck muscle. So I'm supposed to be on that side, but for the camera purpose, I am gonna do from this side. So you stick your arm under the neck, so you can see these fingers right in here, right? Try to get this as far as possible. So his neck is on my palm right now. What I'm doing here, actually I have to do this hand. Here we go. So what I'm wanting him to do, I'm start pulling my arm up and ask him to rotate to the same side, to this right side. Go ahead, turn very gently, and I pull this up. Let it go. Pull this up. How's it feel?
I mean, it feels alright. I feel still some limitness.
Of course, he's still limitless. Like I said, let me just do it how I will do without like a camera. So it's right in here, watch. I'm come up here and I start turning to the left. He start turning to the left and I'm lift that up. So
Yeah, that feels differently.
that feel
Much
different, of course, because I'm trying to do for the camera purpose. Try to get squeeze. See my fingers now?
Mm-hmm.
And I pull, rotate to the left, and I lift it up and let it go. Good. Again, grab, turn to the left, and I lift them up. One more time. Slowly turn, rotate. There we go. It's even like something click. The one of the vertebrae click. Next one, I call this bowling. You know, when you dry the bowling, you kind of like lift your arm up so your bowler starts spinning. Same with this head. You're going to grab that occipital area like a bowling ball. You see it's holding like a bowling ball. And what do? Another hand is apply on the forehead and you start tuck your chin. Ask him to tuck the chin. What we're doing here, we open those vertebrae. You see my head is rotated, another one. So I'm doing kind of this motion, like I said, roll that ball. And I'm roll it. Perfect, just like that. Next one, I usually stay on my knee, try to sit down. And I pull this head first, now lift it up and get this on my elbow. And this occipital area, it's right on my palm. I do not cover the ear like this because you're going to create this vacuum and the ear, some people don't like that. So open this finger spread so you're not compress that ears. And all you do, same thing. You tuck that chin. How's it feel?
I mean, it feels very nice.
It's feel very nice. Yes, it's kind of stretchy. You teach your client do flexion of the spine. Remember, he's have some flexion limitation. So tuck and relax. He can also resist you, push back, kind of push back. He's pushing back, I'm resisted and let it go. And you can get him to the next level. You can also do some, you see, kind of massaging this OA joint area. What all you do, just move your hands. See, you do not compress those ears. Like I said, it's going to be painful. You can do little side banding. See, my back is straight on one knee. You can do, I see people like lean forward. I think it's too much work. Also, tuck and stretch. Cross, arms, pull more. Ask him to resist, push down towards the table. Let it go and pull more. Okay? Come back. Do rotation. Very easy. Help him out. A little bit working at that OA joint. So this OA joint right in here, I'm not go to the midline. So a lot of people start midline. We got this arteries coming up here, occipital artery. So we just kind of tuck. And release, turn to this left side. Let's play the game. Go ahead, try to rotate. So he resisted. I placed my hand and I resisted and let it go. And I can give him further again. Try to relax. I feel this on the left side, yeah. Pain?
Mm-hmm.
Where, on this left side?
Yeah, where is your thumb?
Exactly, so I feel that exactly right in there. So I'm gonna be light up a little bit and work very gently. Turn. There we go. Something just pop. So you see, I rotate, and now all I do just tuck that shin, and my finger is helping to move those vertebrae, get some more space. And let it go. Okay, let's go back to the shoulder because I really want to show you improve of that shoulder. Remember, we got that bad shoulder. We already measured before we start this treatment. Pecs. Again, look at this. Remember the last time I can't even get to this 90 degrees. Now we passed this 90 degrees. It's already 110, 115. So what I'm doing here, I grab that pecs muscle, hold it, and ask him to move around. So I hold it like a sandwich. I grab like, here we go. And you're moving around. Found that very, very tight pecs muscle. You drive bicycle, right?
From time to time.
Yeah, so people with the bicycle, they doing this or they sitting, they grab that. This pecs muscle is always become tight. It's not a tight, this is how you build your postural with your everyday pattern. Sitting slouch forward, this pecs is always dominate muscle. Start asking to rotate. I use my palm right now. I'm comfortable here. Sometimes if I'm tired, I'm just sit down like we did this last time and pointing this way. Grab that pecs and ask him to rotate in and out. Yeah, in and out. In and out. We show this many, many times. But the practice make it perfect. Rotate. Do you feel that?
Yeah, I felt like in
I feel that too. Every time he's go this way, it's my elbow is pushing out. You can do external, internal rotation very gently. I see a lot of people like pushing very strong. I'm just light push, and even kind of like pulsation movements, and just prepare that and push against me. Push. 1, 2. Push like 10. No. Don't push hard. Okay. 2, 3 pounds. Don't put like people start pushing so hard. Don't let them push hard, and let it go. Always breathe, and get this external, internal, whatever you can go. That first restriction barrier, you feel it, you don't go further. Just bounce right there and go back here again. Breathe. Very gently. Remember, if your client experiences pain, not good. He's going to guard it. Again. We already work on the subscapular muscle. Rotation. Try. You see, he's kind of guarding. I can grab that first rib, pull down the clavicle. My hands is right under this clavicle. And some people are very sensitive, so always ask, is that okay? It's good. It's very sensitive because they've been jammed that brachial plexus nerve between the first rib and the clavicle, and for some people it's painful. Like a hairstylist, electrician, they're constantly doing this. And they always pain, tingling in the arms. So always ask them what they do, what kind of type job they do, and ask him what's the most movements during the day, and you will understand the postural. And during the practice, years and years, people come in, what are you doing? Oh, I'm an electrician. Okay, I already know what's the problem can be with this person. And always ask those questions. Mobilize that shoulder. You see, I didn't lock the scapula. I'm just moving scapula and that humeral bone. Now, I am gonna lock that scapula. So I pull my arm under the scapula, hold it, and just rotate that humeral bone, not the femoral. There you go. I'm stick in, rotate. We already done this. We'll just keep returning. So many injury with the shoulder. So many limitation. You guys go to the gym, you grab those heavy weights or clients, and they never check. Can they capable to do those movements? Can they capable to lift that 20 pounds up? No, they not. That's what the injuries come in. Okay. So this is, yeah, here we go. See if we can improve. Okay. We can do neurotraining, remember? I want you to start turning your head left and right, just like this, without pain. Turning. Perfect. And now just look straight, your head is straight. Only your eyes look left and right, left and right. So what he's doing right now, he's just moving his eye left and right. And I see which way is easy for him to look.
Left.
Exactly, I can see it. This is so interesting when you look at how people look. And now look to this to the right, sorry, and see if you can take a little bit further. I did a little bit further. You can play that game all day long, and you can reach that limit, the angle you're looking for, that degree, the range of motion. Again, and this is, like I said, second session. The first time we work like 15 minutes, and it's another 15 minutes, and see what's the improvements. Okay, this is what I want to do just in this position. Go ahead, stand up very slowly. You see, I don't want the clients get up like this. I want to show him, no, let it go. So I want to teach my client how to get up from the table, and you want to do the same thing, especially for the lower back. You always show the clients, I want you to roll to your left side, to your right side, like this. Now, his leg is coming out from the table. You see the leaning, and he push with his arm and lift it up, and you help him out. Here we go. And from here, you can work on those sitting position, which as I love to work on that posterior kinetic line. Open this up, open this chest. But not today. We're going to do this next time. So go ahead, get up and see how you feel. Move that neck. If you feel there's any improvements, let me just get that camera.
Yeah, I think my range of motion is the same with the left side, on the right side now.
So it's better?
Yeah, I think it's the range of motion the same. I still feel some kind of,
Little bit still there?
discomfort, but I mean the range of motion is here. I think I wasn't able to turn it.
Okay, let's show me your shoulder. Show me that shoulder. Move.
Okay, once more.
Yeah, it's definitely, yeah, you see he tried to compensate. We still need to work on that shoulder. And I believe the exercise is going to be the best. So if we add exercise, it's definitely improving.
It was like that before, and now
Yeah, you can get better.
degrees.
Okay, let's sit down. I do this kind of stuff too. Go ahead, sit down. So I'm sit down on the side to the client is put that shoulder on me, and I'm usually do from the other side. Yeah, let me go from the other side. See if I can. Yeah, so he's pointing up here, and I'm rotate down, kind of lean. Rotate up and down. So I hold that. I'm not that, help that shoulders not rise up, and rotate it down and up and kind of lean. He's lean with me. Any pain?
No.
Good. Okay. Let's bring that hand back behind your back. You see, that's what the issue. So it's also in the spine. I come up here. The one arm is coming right on that shoulder. Another one right between that shoulder blades and kind of hold that scapula. Okay, and what I'm doing here, so he's pushing forward. Go ahead, push forward. Very gently. And release. Release. If person can't do it behind, I just leave it right here on the side, and I'm just doing this. Push forward, shoulder, and relax. And when he's relaxed, I'm moving around. I also help with this arm is pulling on the back. Here we go. Oh, look at that. Push forward. Let it go. I'm definitely need to give him exercise. Next one. On the side, thumbs up, and you just do small motion. I'm grab that shoulder, and I mobilize. You see, I'm grab it, and I'm help him to move. I'm open this up. I can give him the band. The band can be on the side, so he can get a little bit more tension. Rotate. Go opposite way, this way. Now going that way. Here we go. And I'm go opposite way. So he's rotated forward, and I'm going backward. So it's create that rotation. That delts, I feel delts. Feel that scar tissue right in here. Really good. Okay, drop this arm again. He can't go like that far, so we just let him go and push again forward very gently, just the shoulder. Let it go, relax. Here we go. Did you feel that click?
Yeah, I felt it click.
Something just popped, and that was great right on that scapula. So this is the motion. Push and moving around, yes. This is the sitting position. I usually show the whole sequel of that and action, but I want to help him out. And you see, I'm not kind of shrugging. I'm just relaxed. My arm is right here. And if you have electric table, it's perfect. You can do all different levels and see how he's moving now. Look at that shoulder. Okay, try to do the same thing. Look at how he bring the arm
While
in
we
the back.
did the last set of motions, I even realized that I'm not moving my right arm like
Exactly.
my shoulder. I start to move the whole body just to compensate
Exactly.
the lack of motion.
Yeah, because the scapula is kind of stuck. Let's try to do it again. It doesn't matter. Now look at that.
No, it's much better.
Look at that. Like I said, the exercise. He been injured the shoulder, and the problem is the brain don't want that action because he's going to be injured again. And it's a lot of stuff with the ankle sprain, the shoulder stuff, everywhere. The brain is primal function of your brain. It's do not feel pain and it's protected from that happen again. So that's why we get limited compensation. We need to prove the brain he can move this again, and that's what we're doing in this therapy. This is all what the physio massage is all about. Now we're going to give him a bunch of exercise and see how we're going to feel. Okay, thanks for watching. Лучше, да? You got it better, right?
Much better.
Much better, yeah.
I mean, I never realized that I'm moving my body when I'm moving my right hand before.
Yeah.
Set of motions.
We can do this. Let's try to do wall angel. Where's that ball, David?
Oh, the little ball is here.
Yeah, you didn't. I thought you stole it already.
Do you want your camera to put your camera on it?
Oh yeah, it's fine. It's already recording. So come over here, Daniel. We're gonna show him homework, slightly homework. Come over here. So we're gonna work on that shoulder. And what I'm doing here, he said, let's start with the wall angel, of course. So wall angel, he's attached his butt, head, and you can see he's looked a little bit up. Don't be nervous, it's all good. And just get your arms on the side like this. I'm not starting from here because he's not capable to do. What I'm doing here, I'm attached to the band, and I start, yeah, that's the shoulder. So I start pulling out, he's resisted. So he's reactivate all those muscles now. So he's pushing this arm back to wall, and I'm just resisted. Excellent. Now I want to get that ball, push this against that ball. So he's pushing that way now. He's activate that muscle in between the shoulder blades, infraspinatus, supraspinatus, all this stuff. Yeah, you see how he's shaking? Don't need to be shake, just Now roll, kind of push that ball and start roll up and down. Very slowly, control that motion. Don't lose that ball. There we go, and that's slightly. Make sure it's, you can help him out. Always help your client. They can finish that motion. Perfect. Now, we're going to get to this bending. So bend, whatever you can do, bend. Like this, bend. You can go away. Whatever he can, yeah, same with this one. So you see the difference between that one and the right one. He can go backwards, something holding him. Why would just give him the band and ask him to push, try to push towards the table? It's hard. It's hard, right?
Yeah, that's hard.
It's really hard. Yeah, of course, you've been injured. I can do hold up here too. You see, it's help. Okay, here we go. I stabilize that shoulder. Perfect. That's fine. That's fine. Ball again. Push against that ball. So, this is your wall. So I extend that wall. That wall is the ball now, and he can push. It's hard. It's hard for him. I can see it because that injury. I can help. Okay. And I release the ball and see if you can go a little bit more. Try to do more. Okay. We get there. You see, this is get more and more. Okay, he's struggling. I want you to just doing this motion up and down, just like this. Slide. And watch me. I just show it to you. Slide and up and down. That's it. You don't need to do anything else. Get only this elbow. So we're working on that part right now. We don't even want to go there because this might be the elbow is problem too. Both. That arm too. Exactly. So just kind of like, push against. Yeah.
Yeah, my scapula is burning.
Burning. Scapula is burning. That's what we want. We want that scapula slide on that ribs. They want to move. A lot of people that the scapula is not moving. And that's what the issue is. So let's see it. Try to place more now. Yeah, you can do extended. No worries. Extend like this. Yeah, and try to slide. Push yourself. Push up. Look at that. Stay here. Breathe. Now I want to work up here on that core. It's probably breathe. You see, this one is not breathing, so I feel the breath. So I push this side. Here we go. He start activate all those serratus muscles. Here we go. You feel that? Yes. That's what you want. You want them do it by themselves. You only help him and support him. And let it go. See, how's that help now? Try that place. Try to get a little bit closer. Yeah, almost there. I can feel it. We definitely need to work on that elbow too. So it's been injury for 6 years. 6 years, right?
10 years.
10 years. So in 15 minutes, like week before, now with like half hour, and it's get improvement. Look at him. He's like, I can't believe I'm doing this. Yes, he can believe because he's, like I said, brain try to protect that. And we did a lot of good work. We keep going. How's your neck? This band, I will teach him to do neck exercise. Go ahead, put your 2 hands inside the band. Now use that back strap placed behind your head. Behind, and stretch this one forward. This is, get your hands together like this, so it's like a triangle, because you want to protect your eye. And all you do, he's doing right now, he's tuck his chin, tuck, You see, he's tucking his chin. The arm is stay there, and you just tuck back. If he can't do, you help him out. There, it's hard. Yeah, just tuck. Just hold this one. There we go, and tuck. I'm helping because he's moving his arm. That's how it is. Good. You're going to be surprised right now. Now, one arm go a little bit deeper around your wrist and turn this to the side, right in here. No, let it go this one. Only on the side. Here we go. You see, it's kind of roll it. All I want you to do is just hold and start turning to the opposite side. Yeah, try to look towards me. Make sure its band is not slide. I usually use the wider band. It's going to cover your whole head. I sold that iron neck. It's $500. This is $2 band, and it'll do the same thing actually. I mean, that's fancy stuff because it's a 2 rollers, and when you roll inside, that big roller come around. It's really cool stuff. If you have extra $500, definitely buy that for your neck. If you're a professional wrestler, boxer, or athlete, try to switch. So get the other arm. Here we go. He's already know. You see, easy, all natural, and start turning the opposite side. You can also readjust your band. It's always nice when it's wider. Yeah, always do those homework with your clients. Couple more. And release the band and turn your neck around now. See how's it feel? Look at that. Look at that neck. So like I said, some muscle just not active. They sleepy. Feel
I
good?
think everything is good. I just started to feel maybe my right shoulder is a little bit upper than the left one.
Yeah.
That's what I feel when I turn in the head now.
Yeah. So
feel
because
Full weight is the neck, but I started to feel that my shoulder is.
yeah, we give him more exercise. We give him band with a shoulder shrugging shoulder, that kind of stuff. Pull that scapula back because it wasn't sliding back. Remember when we did this on the elbow, he said, wow, I feel my scapula start burning. Yes, because we apply that pressure and the scapula start rotate under the rib cage. And that's what the key is. This was all about physio massage. Let your client do the work and just guide them. And that's where the healing is. All right, you guys have a good day. We're done for today. Shit. Okay.